Hi, I'm Dr. Goel. I'm a general neurologist. Welcome to my channel. Through this channel, my attempt is to explain neurological conditions in simple language. In this video, we will be covering treatment options for trigeminal neuralgia. As we have already covered what trigeminal neuralgia means and what are the manifestations of it in another video, I will not be covering that in this video. The treatment options for trigeminal neuralgia include medications and surgical options, surgical/procedural options. The medications are typically nerve pain medications that are also used for other neurological conditions like seizure disorders, neuropathy, cervical or lumbar radiculopathy, which is commonly known as pinched nerve in the neck or lower back. Some of the names some names of the medications that are commonly used as carbamazepine, oxcarbamazepine, lamotrigine, gabapentin, topiramate. When medications are not effective in controlling the pain optimally, or if patients are experiencing side effects of the medications, then typically surgery or other procedural options are considered for further management. Talking about side effects of these medications, now typically these medications are very well tolerated in majority of the patients, but in some patients there may be some increased drowsiness, fogginess, or balance issues, or reduced mental alertness, and all of that. I always advise my patients that look, all medications have potential side effects. When you are in so much pain, it's worth trying the medication and seeing if that works for you. If it does not, we try another medication or we discuss other options. I would still, medications are still the first line in terms of managing trigeminal neuralgia pain. Now, let's talk about the procedural or surgical options. There are three of them. One is microvascular decompression surgery, and in this they target the root cause. If they're able to see a compression on the trigeminal nerve, the surgeon can make an incision behind the ear and go inside the skull, enter into the skull area, and relieve the compression on the nerve from a surrounding blood vessel. And sometimes they can also insert a little small micro piece of Teflon sheet that prevents it from compressing the nerve in future. It is an invasive surgery. There are higher risks involved. It has very good success rate, but it's all about assessing the risk versus benefit of the surgery, and also having an experienced surgeon in the area who can perform the surgery for you. There are two other very good options. One is gamma knife surgery, and the other is radiofrequency ablation. In gamma knife surgery, it's not a surgery at all, in the sense it's non-invasive. There is no incision made. The gamma knife is actually a device where it targets very strong focused gamma rays to the trigeminal area, to the trigeminal nerve where it enters the brainstem, and it damages the nerve at that point, and so it disrupts the signal transmission, and hence the pain is relieved. So that is a procedure that is very commonly offered as well, and it differs from radiofrequency ablation because in terms of its outcome and in terms of its the risks involved between the two procedures. In gamma knife, it can take 4 to 6 weeks to start seeing pain relief, and sometimes maximum relief may not occur for several months. And so patients are often continued on medications for a few months until the pain relief is complete. And sometimes they may need to continue on less than previous medications, but they may need to continue on something. The third procedure is radiofrequency ablation, and the idea is similar to gamma knife, where here you're using radio waves to heat up the pain fibers of the trigeminal nerve and to damage them so that they don't transmit pain signals. However, the access is different. It is delivered through an electrode that's placed through the cheek into the and it goes close to the path of the nerve, where it targets the nerve fibers. It is radiofrequency ablation can be effective right away, and but it is slightly more invasive than your gamma knife surgery. I hope that answered a lot of your questions around treatment options for trigeminal neuralgia. And I hope you found this video helpful. And I hope you will continue to watch some other videos of Neuro Nuggets. Thank you.